Hi, my name's Jeannette. I'm an LCC student nurse. I'm going to be doing your physical assessment today. Can you tell me your name and date of birth?
Tom Richmond. Date of birth is May 14th, 1986.
Great. So just before we get started, I'm going to do a quick general survey. Just so you're aware, I did clean my equipment before coming in. It looks like you're well groomed, good hygiene, male, age 34, and you seem to be speaking clearly. I said your general assessment checks out great. What are we here today for?
Knee pain.
Knee pain, okay. So it's in your knee. When did this pain start?
A couple days ago.
What does the pain feel like?
Just kind of shooting pain.
Shooting?
Yeah.
Does it radiate anywhere else when it's shooting?
Just
in the knee?
Mostly around the knee, a little bit in my lower leg, upper leg.
Okay. And then, is there anything that you associate with the pain?
Running.
Running,
Yeah,
okay.
Yeah.
And then how long does the pain usually last?
While I'm running, and then maybe a couple hours afterwards.
Okay.
Yeah.
Is there anything that makes the pain worse? I know you said running. Anything else?
No, if I'm putting too much pressure on it.
Okay.
But, yeah.
And anything that makes the pain feel better?
Ibuprofen.
Ibuprofen?
Yeah.
Great. And then on a scale of 1 to 10, what would you rate your pain as today?
Like a 6, 5 or 6. So
Okay. Perfect. All right. So I'm gonna just test your orientation.
Mm-hmm.
Can you give me your name and date of birth again?
Yep. Tom Richmond. May 14th, 1986.
Great. And can you tell me where we are today?
We are at the LCC clinic.
All right. And can you tell me what today's date is?
Today is July 3rd, 2020.
Perfect. So you are alert and oriented times 3. We'll go ahead and move into your eyes, ears, nose, and throat assessment. So
Okay.
I'm going to test your pupil response. Right. I'm just going to put my hand here. Perfect. Perfect. Alright, so your pupils are 4 millimeters bilaterally, and they are round, reactive, and responsive to light, both indirect and direct. I'm going to go ahead and use this again to check your nose and your mouth, but before I'm going to just check your eyes, so I can have you do this.
Mm-hmm.
Great. Conjunctiva is clear and sclera is white. Nose is patent. Can I have you open your mouth? All right. And then can I have you pull your gums up on the top? Perfect. And then on the bottom? All right, great. So your mucous membranes appear intact, no missing teeth or dentures, and no lesions in the mouth or the nose. Then go ahead and check our ears. All right, ears and the back of the skin on the ears appears intact, no excessive cerumen. I'm going to check the back of your head. All right, so your skin appears intact on the back of your head as well. No issues with those pressure points. All right, we're going to go ahead and move into our respiratory assessment. So if you wouldn't mind, I'm going to take your pulse right here.
Okay.
Sounds like your breaths per minute are about 14 breaths per minute. Can I have you take a big breath for me? Great. Chest expansion is symmetrical Your breathing rate is normal, seems to be effortless, and your rhythm is normal as well. So we're going to go ahead and start. First I'll measure your AP to T, so that. Alright, so your AP to T is 2 to 1, which is normal findings as well. I'm going to have you come on over and sit on this chair so that we can listen to your respirations. Could I have you turn your back this way?
Sure.
Perfect. Go ahead and take a full breath in and out. All right, I'll have you lift this arm up. I'll have you lift this arm up. All right. And then can I have you turn your body around? And you can go ahead and sit back up on the So lung sounds are clear to auscultation in all fields bilaterally. So we're going to go ahead and move on in our respiratory assessment to check your pressure points. So we'll look at the skin on your shoulders and your scapula and your elbows and the back of your ribs, and all of it appears intact with no remnants or breakdown. Alright, from there I'm going to go ahead and move into your cardiac assessment. So I'm going to have you lay back on the table.
Okay.
Now, in a clinical setting, I would raise your bed up 30 degrees to test your JVD, but because we cannot do that in this setting, I'm just going to actually take your pillow for just a second, and then I will replace it in just a minute. Okay, so you can go ahead and put your head down. Will you look to your right? Right. Only no distension. Go ahead and look to your left. Perfect. No distension on that side either. Alright. I can put this back under your head now. Alright. Is that comfortable? Okay. You may go ahead and feel for your carotid pulse now.
Okay.
Can I have you look straight up? Thank you. Great. So carotid pulse is +2 out of 3 bilaterally. I'm going to go ahead and feel for your carotid while I listen at your aortic listening site. Alright, so your carotid pulse correlates with S1 at your aortic site. So we're going to move on and go ahead and do your cardiac assessment. First, I'm going to start by getting your heart rate. So I just need you to relax and try not to speak for the next little bit. Alright, so your heart rate is approximately 67 beats per minute. We're going to go ahead and work our way through our listening sites to make sure there's no abnormalities in those. Is there any way I could have you scoot a little bit this way? Thank you. Alright, we're going to start at our aortic listening site, which is 2 intercostal spaces down on the left sternal border. Heart rate of approximately 67. Rhythm is regular, and S2 is louder than S1. And there are no signs of murmurs, rubs, or splits. Alright, and now we're at the pulmonic listening site. Heart rate is approximately 67. Rhythm is regular. S2 is louder than S1. And there are no murmurs, rubs, or splits. Okay. Now we're at Erb's point. Heart rate is approximately 67. Rhythm is regular. There's no murmurs, rubs, or splits. And and Erb's point is at the 3rd intercostal space on the right sternal border. Left sternal border, sorry. Alright, now we're at the 5th intercostal space on the left sternal border, which is the tricuspid listening site. And heart rate is approximately 67 beats per minute. Rhythm is regular, and there are no murmurs or rubs at the tricuspid site. Alright, and lastly, we're at the mitral listening site, which is the 5th intercostal space, mid-clavicular line. And there are no murmurs, rubs, or gallops at this site. Heart rate is approximately 67 beats per minute, and rhythm is regular. Alright, so now I'm going to go back through and listen to those same spots again, briefly with my bell, to make sure that nothing is heard that way. And so no abnormal sounds were heard with the bell either. I can have you sit back up. All right.
Good.
Okay. All right. So we'll move on to our peripheral neurovascular. I'm going to start by doing a blood pressure. Is there any reason I could use one of these arms?
No.
Okay, so we'll go ahead and use this arm right here. Let me grab you another pillow so you can put your arm on that. for our blood pressure, it is a 2-step process, just so you're aware. First I'm going to measure briefly, make sure that is 40. And bladder, 80. Alright, how does that feel on your arm?
That's good.
Alright. So I'm going to find your radial pulse. And then I'm going to pump this up until I don't feel it. Apologies. So your pulse goes away at 140. I'm going to give you a little bit of time to let that rest up. Alright, go ahead and so your blood pressure is 128/62. That is normal findings. So for peripheral, I'm just gonna check. It looks like you have no abnormalities in skin color and no lesions or scars that I can see that are visible on your upper extremities. Temperature is warm and skin is dry. That's your capillary refill. Great. Okay. Refill is brisk, under 2 seconds, and no signs of clubbing is present. Go ahead and do our grip strength. So if you could go ahead and grab onto my fingers, give them a good squeeze. Great. I'm going to push towards you. I would like you to resist.
Okay.
And then I'm going to pull. I'd like you to resist. Great. Let me check for our shoulders, elbows, wrists. No signs of any redness or breakdown at our pressure points there. And we can move on to our abdominal. So if I could have you lay back down one more time. Go ahead and use that. I'll put this under your knees. Is that comfortable for you?
Yep.
Can I have you put your feet down just so that, great. Alright, so first I'm going to do a little bit of an inspection. So, abdomen is round, non-distended, and symmetrical. And so I'm going to go ahead and listen to your vowel sounds. Before we do that though, have you had any nausea or vomiting?
No.
Okay, and then any flatulence
No.
outside of normal ranges? And when was your last bowel movement?
Yesterday.
Okay, perfect. So let me go ahead and listen to that. Tell me. Alright, so vowel sounds are heard in all 4 quadrants. I'm gonna lift your shirt, I don't have to lift your shirt up, but I'm just gonna press firmly, but to test for any kind of masses or anything, okay? Sorry if you have, it's a little ticklish. Okay, so no masses are felt.
Great.
So all your abdominal assessment is coming back normal. I'm gonna have you stay lying down to do your peripheral lower assessment, but I do need to go back and find your pulses in your arms really quickly. So if I could have you put your arm right here, I'm gonna go ahead and feel for your brachial pulse. Alright, so brachial pulse is +2 out of 3 bilaterally. And then I'm going to go ahead and feel for your radial pulse as well. Radial pulse is also +2 out of 3 bilaterally. And lastly, I'm going to go ahead and feel for your ulnar pulse. And your ulnar pulse is also +2 out of 3 bilaterally. So moving on to your legs. Is it alright if I slide your shorts up just a little bit?
Yep.
Would you like to do it, or are you okay
Yeah,
with
that's
me?
fine.
Okay. Alright, so your skin color appears to be appropriate. No abnormalities or lesions or redness or signs of breakdown on your legs. Go ahead and feel temperature. Skin is warm and dry to touch. I'll test the capillary refill. Capillary refill is brisk. And I'm going to go ahead and feel for your dorsal pedalis pulse. Great, so that's +2 out of 3 bilaterally, and then I'm going to feel for your tibial pulse as well. Alright, also +2 out of 3 bilaterally. So I'm going to check for edema quickly. Alright, no signs of pinning edema or any kind of edema on your lower extremities. Alright, so next we're going to test your strength in your legs. So I'm going to put my hands here. Go ahead and push down on my hands like you're pushing on a gas pedal. Great. I'm going to put them on top of your hands. Go ahead and lift them up. Perfect. If I come and hold this leg up, can you push it down? Great. And then if I push down, can you lift it up? Great. And we'll test this one too. I'll lift it up. Go ahead and push it down. Perfect. And then I will push down. Go ahead and pull up. Great. So your peripheral lower vascular is also done as well. So if you wouldn't mind just coming and sitting up. Go ahead and stand up.
Yeah.
Touch your head.
Yep.
Great. Can I have you take a few steps forward? Great, and a few steps back. Perfect. Your posture is erect and straight, and your gait is balanced and smooth. Everything looks great except for that knee pain that you mentioned. So we'll go ahead and get the doctor in here to see what we can do about that. But your physical assessment went great. Do you have any questions?
I don't.
All right, so here's your call light, and when we're done getting a plan of care together, we'll be back in to see you.
Great.
Great, thank you.
Thank you.